everyone? Let me know, then we'll start. Let me confirm. Am I audible and visible? Am I audible and visible? Okay, fine. Hello everyone, welcome to Unacademy Future Doctors. I'm myself Dr. Dipti Kariya. I'm MD PhD Physiology, Associate Professor. I'm educating MBBS, nursing, physiotherapy, dental and MD students, and I have more than 17 years of teaching experience. Now, let me explain in brief about our subscription. We have two kinds of subscriptions. One that is plus subscription, in which you can access the best, you can choose the best from the best. Here you can access both live as well as recorded classes. You can study on the device of your choice. Here you can learn from India's top educators for your medical exams. You can access question bank, which is having more than 25,000 questions. You can complete in the live test and quizzes, and with 12 months and above subscription, we will provide you printed notes too. Second, that is iconic subscription. Here your access to the best from two of the best, and they are, one is Unacademy and Prep Ladder with Unacademy. Here all the features I have already explained. Second is Unacademy and Prep Ladder with Prep Ladder. Here you can have clinical and integrated essentials, video lectures from the dream team, question bank 3 with active guidance, system tags and more, rapid revisions and snapshots and treasures, and 2021 free notes. We also have added certain features in our special class. We made it interactive by adding the feature that is, you have a feature of raise a hand. You can poll for the learner. You can never miss a class. As always, you are notified. You can get PDF lecture notes and you can access them at any time and at anywhere. We also have updated and highly effective question bank, which is having more than 25,000 high yield questions based on latest exam pattern with detailed explanation too. These are our NEET PG September 2021 toppers. We also have started our Focus FMG 2022 comprehensive batch, which is from 15 December 2021, that is for 6 months, and Target NEET PG 2022 test and discussion batch from 15 December, that is for 3 months. You can subscribe any of them, either Plus or Iconic, from your mobile, and you can get 10% discount when you use my code DIPTI10. Also, there is a big surprise which awaits for you. Here we have our NEET PG Combat, that is on 23rd January at 11 a.m. Okay, you can enroll and you can get a chance to win Amazon vouchers as well as free scholarships too. You can see you can get reward from a pool of rupees 10 lakhs. Top rankers, they get chance to win 100% scholarship. Here note down the dates, that is 23rd January at 11 a.m. Test is for 60 minutes, 45 questions you have to crack. Questions are from medicine, dermatology, anesthesia, psychiatry and radiology. Here, as I told you, rank 1 gets the chance to win 100% scholarship, 2 to 10 75%, 11 to 50 50% scholarship, and 25% scholarship is given to the rank 51 to 200. Also, we have educator curated test, which here you have to crack 30 questions, and the subjects 17 January ENT has already been conducted. On 22nd January test is for ophthalmology, and for pathology, that is on 28 January. You can use my code DIPTI10 to unlock free test. Okay, here also scholarships are available. Rank 1 get 1 year plus subscription, as well as 5,000 Amazon vouchers. Rank 2 gets 6 months plus subscription plus 3,000 Amazon voucher, and rank 3 gets 3 months plus subscription plus 2,000 rupees Amazon vouchers. So grab the opportunity and do your best. Now, so today I will discuss about how to study physiology. Okay, in today's session, we will discuss how to study physiology in medical college. As I know that all of you are NEET aspirants, you have cracked your NEET UG and now you are waiting for the admission in medical field. Okay, so how to study my subject, that is physiology. So today we'll discuss that the best way to learn physiology and come out of the first year successfully. Okay? Although memory has an important role, if you have sharp memory, then you can easily easily remember the things. But tricks as well as plannings, they are also very beneficial. Okay, if you have good memory, but if you are not working well, then what happens? If you are not reading well, then it is useless. Okay, so not only memory but tricks and planning also, they are very much beneficial. Okay, now as we have discussed that in any of the medical and paramedical faculties, you secure admission. Suppose if you feel that you have cracked your NEET UG, now you're waiting for the admission, you may say that, ma'am, I'm not sure that whether I'm getting admission in physiotherapy, in MBBS, in dental, in nursing. But the thing is, in any of the course you take admission, you must have to learn these two subjects. One, that is anatomy, and second one, that is physiology. Okay, so these two are your basis. Okay, these two are the basis of medical studies. Okay, so now in today's session, as physiology is my subject, I will give some tricks to study physiology, although some of the tricks are common for all. So it will be beneficial for other subjects too. Okay, for other subjects also, these tricks may be helpful. As I already mentioned that I have more than 17 years of teaching experience, and I wish that my experience must be useful for the students. Okay, for getting out of their problems. Okay, as they are facing problems in the first year, so if some of my experience will be helpful to them, that is my pleasure, that will be benefited. Okay, I have seen that the students, those students, they have difficulty in first year. Okay, if the person has difficulty in first year, then the student must be having difficulty throughout the study. Okay, that issue, hello, how are you? I'm fine, beta. So here you can see, suppose a student is having difficulty in studies in first year, he or she cannot study well in the first year, he or she cannot make their own concept clear. Then what happens? In second year also he will be facing problem, then in final year also, and vice versa. uh, uh, nice to hear. Okay, issue. Second thing is, if the student is scholar in the first year, definitely he or she will crack all the years nicely. Okay, the reason is simple. Two causes are there. Number one is base gets clear. He or she has his or her base clear. Okay, that is one reason why the student who is scholar in the first year will be scholar throughout. And second thing is, suppose if you secure good marks in the first year, your confidence, you have gained so much confidence, so it helps you to be ahead of others in other years also. Okay, so always try to make your base strong, your first year strong. Okay. So this is the motive, that from the very first year, if you are inspired, if you are performing well, if you are regular, punctual, then you won't be having any problem in second and final year as well as throughout your medical career. Okay, I have seen, I am telling this thing from my experience. I'm not just telling vague things. Okay, am I clear? If you are doing well in your first year, definitely I can guarantee you, I have never seen like that. Suppose some student is doing very good in the first year and doing bad in the second year. I have never seen in my career of 17 years. Okay, or you can ask to your seniors if you feel that madam is just uh, trying to give importance to her subject, and for that reason madam is telling that make your base clear. So you can ask to your friends. Most of them, they say that major difficulties are there in first year. So if you make your first year smooth, then you definitely will be having no problem in remaining years. That I have seen all the students. If the student is not doing well in the first year, definitely he cannot do well in the second year and final year. Okay, so this is the common thing which I have observed. So here with this platform, you are getting the chance to make your first year, because in this COVID situations, you don't know when your colleges will start and how the studies will be. Some of the students are very confident that ma'am, it is good that COVID situation is there and we need not have to go to college, so that is fine, we will pass without going to college. And this way you can pass, but only passing is not enough for medical field. You have to be with your patient, and when you are in front of your patient, then not only degree matters, it matters your knowledge. Okay, so medical field is gaining knowledge, it is not to pass. So do your thing with your best efforts and you will get the return best. Okay, so this is one of the thing which I observed in my experience of 17 years. Okay, now, so here our motive is not to pass. Our name of our channel, you can say that is Unacademy Future Doctors. So our aim is to prepare good doctors. Okay, so prepare yourself, make your issue good. Knowledge matters, not degree or marks. That is very true. That is very true, because every day you cannot tell everyone that I secured this many marks. So marks are not important in front of your or rather than your skills and your performance. Nobody will ask you marks. After once you are there in the career, to reach to the career you require marks. Okay, but if you are doing well, definitely you can score well. That is my this observation. If you are not doing well, you cannot score well. Okay, so this is a byproduct. Marks is a byproduct of our hard work. Okay, now we come to our topic, how to study physiology. Okay, as I am physiology teacher, I will guide you. Some of the points, they are common. If you are 12th standard student, if you are homeopathy student, Ayurvedic student, if you are 10th class student, some of the points are common for all. So they are beneficial for all. Okay, so how to study? The topic is broad, how to study. Okay, so you can follow, if you're following it, your preparation becomes easy and very good. Okay, now, so physiology is, first of all, most of the students, what they do is they try to mug up like anatomy. In anatomy, suppose if you are reading anatomy, you just have to mug up certain things, like this is the brachial plexus has this many branches, so you just have to remember, no other option. But physiology is not like this. In physiology, you have to understand the topic first. Okay, first understanding, and then you have to remember. Okay, so only cramming is not beneficial if you are studying physiology. Okay, so what happens most of the time, physiology students say that we cannot understand physiology. Why? We cannot remember physiology. Why? Because they just try to mug up everything, and that is not possible for physiology. Okay, that is one thing. Second thing, if you understand it and try to remember, that becomes easy as well as interesting. So first step is, don't try to mug up like anatomy or like your 12th standard. Just try to understand and then try to remember. Okay, so this is first tip. Next tip is, sometimes students, they have difficulty that which book to follow. Like in anatomy you have a particular book. Like most of the students for gross anatomy, they are studying BD Chaurasia, okay, BDC. Okay, so that is a fixed book. You need not have to worry more. But in physiology, there is no specific book. So you always have to refer 3 to 4 books. Okay, and you have to prepare your own notes. In the initial videos of strategy session, I mentioned names of the books. Okay, so you can go through that. You can find out books which are useful for physiology, either Indian author as well as foreign author books. Okay, now next difficulty is how to read this 3-4 books at a time. Okay, so we have solution also for that. Suppose whenever you are reading topic from this books, first of all make one book as your base book. Like suppose, as I told you, Indian author books are Indu Purana for physiology, then other book that is A.K. Jain, and foreign author book is Guyton. At least 3 books are needed. So suppose you are making this Hindu Purana as your base book. So first of all, what you do is you just read the topic from Hindu Purana. Okay, then after reading the topic from Hindu Purana, then you read the same topic from the next book, A.K. Jain, suppose. And what you have to do is, suppose if you have read Hindu Purana for the as a base book, then some extra point you found from this A.K. Jain you add in this book. Like suppose this is the book, so here you can write down some extra points you find here, or you can attach cheats here and write down some extra points. Then you read the same topic from the third book, Guyton, and extra point you can add in your base book. Am I clear? Then another tip, suppose you have attended lectures and you found that something new teacher told me, so that also you can add in your book. Okay, issue, I am in the government medical college, beta. I am teaching in the government medical college. Okay, I hope you will be my student. So this way, what is the benefit of this? Benefit of doing this, making one book as a base book and other books, reading other books topics added. Okay, here what happens, at the time of exams you need not have to read all these 3 books. You have already added everything in your one book. Okay, so this becomes very easy for the student. I just repeat how to read. Suppose these 3 books you are referring for physiology. Okay, so make one book like Hindu Purana as your base book. Okay, read the topic from Hindu Purana. Then same topic, read from other book, second one, A.K. Jain. And if you find that 5 points are extra, okay, so this 5 points you add in your Hindu Purana. Again read the same topic from Guyton. If you find that 2 points are extra here, add it in this Hindu Purana. Okay, so this way you can make your one book in which you have all the material gathered. So at the time of exams, you can read all the material by reading a single book. Another tip is, just go through past 10 years university papers. Okay, yes, university papers, and find out questions and their answers. For question answer, there is physiology notes is also available. That is also available on Flipkart. Okay. So these questions which are most frequently asked, you just note down in your book. So whenever you are reading, suppose if you are reading muscle physiology, so find out this 10 years paper, 10 papers. So you can get around 10 to 12 questions. You write down with your in your book. So that becomes easy at the time of exam. Okay. Now, next important tip is regular study. Always be regular. Be regular in sense. Suppose your teacher taught the topic today. Okay, whatever topic taught to you today, you just have to try to finish it by today or before next class. You can make this habit. You can make. I am in medical college, PDU Medical College, Gujarat, beta. I am in Gujarat. Okay, fine. So before next day, before your next lecture, try to finish the topic. Suppose if I taught some lecture today and I am teaching next topic tomorrow, before that you try to finish your reading. Okay. So it has two advantages. Number one, because I taught you today, it becomes easy for you to remember. Okay. And second thing is tomorrow's topic also becomes easy for you because you read today's topic. Okay. Another important tip is don't just read and leave. Try to recall the things. Okay. After reading topic, you just close your eyes and try to recall the topic. As well as just before going to bed, before sleep, try to recall the topic rather than using your social media. It's okay, beta. Rather than using social media. Okay. हम लोग रात को सोने से पहले क्या करते हैं? व्हाट्सएप चेक करते, फेसबुक चेक करते. Rather than that, try to remember why. This is scientifically proven that whatever you are thinking or whatever you are recalling before going to sleep, they are stored as long-term memory. So you can remember it easily. Okay. So this is another important tip. Okay. Next tip is just don't read the topic and leave it. It increases chances to forget the topic. Okay. So what you have to do is you discuss with your friends. If you have 2 to 3 friends, then you discuss the topic. It improves memory. Suppose if you have discussed something today and you have forgotten to tell 2 things, then you will remember next time when you are reading the same that, oh, I forgot the topic. So now it will be recalled easily. So discussion improves your memory. This is also one of the important tips. Not only just reading is enough, you discuss with your friends. Okay. Next is try to revise the topic also. That is on Sundays. We have free time on Sundays. Suppose everything, whatever is taught to you, try to revise all the material on Sunday. Or suppose something is left, suppose teacher taught you and you could not complete. Here in this classes also you make a habit from this classes that throughout the day we have 4 classes. Okay, we have 4 classes in a day. So if suppose some topic left, then you can read that topic on Sunday. Okay. Next important tip, that is make flashcards. Okay. You must have heard about flashcards. What is flashcard? Kunal Kumar, ma'am, can you suggest books for the same? For physiology, beta? Kunal, are you asking about physiology? Kunal, give me answer. If you are talking about physiology, I can say that, okay, for physiology, Indian author books are commonly used. Indian author books are Indu Khurana, okay, A.K. Jain, this is 1, this is 2, and foreign author for reference, foreign author book for reference, that is Guyton. And one more book that is also available not in the bookstores, it is only available on the Flipkart, and that is Physiology Notes. That is also by Indian author, Physiology Notes. This contains question answers, and these are textbooks, okay? So you can buy either, I suggest you can buy either Indu Khurana, one from the Indian author, one from the foreign author, and one for the question answer. So these 3 you can buy. Or either instead of Hindu Khurana you can buy A.K. Jain. Okay, so 3 books you must have to buy. One is Hindu Khurana, second is Guyton, and third is Physiology Notes. Am I clear? Am I clear? So this is, you can see, these 3 are textbooks. And this is question answers, for question answer. Okay, am I clear? Kunal, let me know. Am I clear, beta? Any other question? Any other doubt from anyone? In physiology, single book is not enough. Okay, single book is not enough. Minimum 2 or 3 books you have to purchase. 3, 2 or 3. Okay, as I told you, 1, 2 and 3. This you can purchase. Okay, now, so next tip is make flashcards. Flashcards means you make small cheats. Suppose if you read something today which has 5 important points. So these 5 important points, write down in this cheat. Keep this cheat, stick it somewhere. So whenever you just have a look on this cheat, you find that becomes easy for you, okay, to remember. So this is your flashcard method. This also works very well. Okay, these are the cards. They contain small amount of information. Okay, and it helps to recall you the things which you read. Okay, another, questions, quizzes and questions, they are very important. Okay, so time to time try to follow certain quizzes or some question banks. Or what happens, what you can do is you just pick some book and read the question and try to answer those questions. Suppose if you have read the topic like blood physiology, okay, after reading that you just go through questions from that topic. So what happens, you just can remember, recall all the things what you read easily. Okay, so this is also one of the important tip. Next tip is apply your knowledge and correlate it. Correlate means, suppose if you read in anatomy, you read about liver. Okay, in physiology, in anatomy you read about structure of liver. In physiology you read about function of liver, and in biochemistry you read about the metabolism. So all these 3 are interrelated. Okay, in new syllabus this is also very important thing. This is known as integration. These 3 things are together. Not only anatomy, physiology, biochemistry, but your second year subjects, pathology, okay, third year subjects, medicine, they all are related. If you are not knowing physiology, okay, normal physiology पता नहीं है तो pathology भी पता नहीं चलेगी, pathology नहीं पता चलेगी तो medicine भी नहीं पता चलेगा. For example, suppose if I am telling you that you are not knowing normal RBC count, okay, तो नॉर्मल हीमोग्लोबिन यू आर नॉट नोइंग, तो आपको पता कैसे चलेगा कि एनीमिया कितने हीमोग्लोबिन पे होता है. इफ यू आर नॉट नोइंग एनीमिया देन यू कैन नॉट नो हाउ टू ट्रीट द सेम. So this all things are interrelated. This is the reason, as I told you, If the student is scholar in first year, definitely he or she can score better in second year and in final year, and he or she will be the better or best doctor. Am I clear? So this way integration is there. This is just one example. Same way integration is there in each and every topic of physiology with pathology and with medicine. Okay, so physiology is must before pathology and medicine. आपको पता नहीं है नॉर्मल डब्ल्यूबीसी काउंट क्या है, तो ल्यूकेमिया क्या होगा कैसे पता चलेगा? ल्यूकेमिया नहीं पता तो ट्रीटमेंट कैसे पता चलेगी? तो दिस वे. नेक्स्ट टिप इज, another tip for some students they like to write down notes. So if you like that, you just write down whatever things you find in your own words. Okay, your own words, rather than, so next time when you are reading your own words it becomes easy for you. So that is another tip. Second is remember through mnemonics. Mnemonics means, suppose, sorry, here in anatomy and physiology you have to remember sometimes list of the things, like as I told you brachial plexus. तो brachial plexus की branches है 10 branches 12 branches, जो भी आपको पूरा याद रखना है. तो make some mnemonic. Mnemonic means some trick, so you can easily remember the thing. Okay, so this is also another simple method to remember the thing, because so many things you have to remember in anatomy and physiology. So sometimes what happens, you get confused between all the terminologies. Okay, suppose functions of growth hormone, functions of thyroid hormone, so many functions are there. So for that you make some trick, that in functions of growth hormone this the way I can remember. If it is thyroid hormone, this way I can remember. Okay, so this is also another tip. Next, identify your learning style. There are different styles of learning. Some has visual learning method. Some likes auditory learning. Some likes reading and writing learning, and some likes kinesthetic learning. So visual means some like to see videos and they can easily remember. Some can hear lectures and easily remember. Okay, some can read and write and easily remember. And kinesthetic means some can easily remember by holding or feeling or performing, like practical. If you do the practical, you can easily remember. So these are 4 learning styles. Whichever is better for you, just find out and follow it. Best one is this one, audio visual, that we are trying to give you in our lectures. Okay, auditory as well as visual, so both the things simultaneously. So you discover your own learning style and accordingly you choose your method. जैसे मुझे रीड करने से ज़्यादा याद रहता है या मुझे लेक्चर सुनने से ज़्यादा याद है, मोस्ट ऑफ द स्टूडेंट्स आई कैन से दैट दिस ऑडियो विजुअल इज द बेस्ट वे. Plus you can add writing also in this. Suppose you are listening lecture, so visual, auditory, and you can prepare your notes. So this is also, these 3 things you can add. So this is the best method to remember topics. Okay, am I clear? Next is, as I told you, connect with the concepts. Don't try to cram, don't try to mug up. Always be with the concepts. If your concepts are clear, then you can never forget the thing. For example, suppose if you are knowing that in your, suppose your platelet count, okay, suppose your platelet count, normal platelet count is 1.5 to 4 lakhs per cubic millimeter. Okay, so in physiology you will be taught this thing, as well as functions of the platelet for hemostasis, temporary plug formation, stoppage of bleeding. Okay, so these things you have learned in physiology. Then in next year when you are coming in the pathology second year, okay, so suppose in pathology क्या होता है, आपके पास ब्लड सैंपल आएगा, सपोज किसी का प्लेटलेट काउंट 50,000 हो गया, then you come to know that nah, this is not normal. But when you come to know, if you are knowing the normal count in the first MBBS, am I clear? Then only in the second MBBS you come to know that this is not normal. And in final MBBS, suppose in medicine, and in your practice, suppose if some patient is coming, another important thing here, clinical features also we are teaching you that the person is having purpura. Purpura means when platelet count decreases, blue dots are present on the skin. Okay, commonly on the shin of the tibia, leg में होते हैं जहाँ pressure point होते हैं, तो ऐसे blue dots हो जाएंगे. This we are teaching in physiology. So medicine में क्या होता है, suppose आपके पास patient आता है, patient ऐसे नहीं बोलेगा कि मेरा platelet count कम है. What is this showing? The symptom purpura. So immediately आपको पता चलेगा कि do the platelet count. Okay, then you ask for the platelet count. If suppose it is less than normal, so again you come back to physiology. But if your physiology is weak, then all these things are not possible for you. Am I clear? So this way we are building the base on which you are going to build your career. Am I clear? So this is just an example I have given, because so many times I have even seen so many even physicians also making blunders. Why? Because the base is not clear. So this is the reason why to make your first MBBS or first year of medical studies with strong base. Read them, read all the concepts properly. Here, very important, one more thing I would like to tell you is, nothing is not important. Because everything is related to human body. And our human body is very important. है ना? एक भी चीज इधर उधर हो गई तो नहीं चलेगा. This is not machine. We are dealing with human body. And when we are dealing with human body, we cannot afford to leave anything. है ना? जैसे बोलते हैं ना, ऑप्शन में निकाल दिया था. दैट इज नॉट फेयर इन मेडिकल फिजियोलॉजी. है ना, आप डॉक्टर बन के बैठोगे, पेशेंट आया जिसको प्लेटलेट काउंट कम होगा, डेंगू फीवर है, डेंगू में प्लेटलेट काउंट कम हो जाता है, तो आप ऐसे नहीं बोल सकते कि मैंने ऑप्शन में निकाल दिया था, फिजियोलॉजी में पढ़ा ही नहीं था. एम आई क्लियर? सो दिस इज नॉट द वे वी कैन work like. So from the first year, try to make your base very strong, so you won't be having difficulty in second and final year. This is what I want to tell you, that please be regular and start your studies with us. जो भी आज, those who are watching this strategy sessions, I have seen in strategy session more students are coming, so I request them, please be there in teaching sessions also. Not only issue, this is, you are laughing, but this is the fact I have seen. You are, I think, have not faced till date, huh? This is at present. I know that you feel that this may not happen, but this is happening, beta. So try to be there in every session. Try to attend all the sessions and be regular in your studies. This is my advice to all. Okay, so this is all about today's topic. Thank you. If you like my video, you can like it, you can share with all your friends, not only medical but all the friends. Okay, paramedical or dental, nursing, physiotherapy, any of. And you can subscribe our channel Unacademy Future Doctors.